Some things that make me really excited about being a radiation therapist with SkinCure Oncology is I get to be independent and I also get to be part of a team.
I think SkinCure is a wonderful opportunity for a radiation therapist who loves patient care, that one-on-one contact with the patient.
What SkinCure Oncology does is we partner with dermatology practices across the nation.
We're practice partners with them, so we actually have our own space, our own schedule. So as the therapist, you have a lot of ownership.
You're not just treating patients. You're calling the patient with results. You're checking their insurance benefits. You're scheduling their treatments. You're getting to know them and develop a relationship with them throughout their course of treatment.
We do have a lot of responsibility. We make sure that our practice is certified, our registration is up to date, all of our paperwork is intact, but that's not scary, right? Because we have a whole support team that's always with you. You are never alone.
We have a weekly grand rounds call that has a radiation oncologist and a dermatologist, as well as all your fellow radiation therapists in their clinics across the country. That appeals to me because I know that there's someone that has my back.
A radiation therapist might think they're not qualified, but as long as they have passed their board exam and they carry the license, they are qualified. Beyond that, we take over in their support. We provide ample training to set them up for success so they can fly solo.
A day in the life of a radiation therapist at SkinCure Oncology starts like any other day in radiation oncology. We warm up the machine with the simplest procedures. After warm-up, we get our charts together. I do like to discuss with the dermatologist what I have going on for the day. Then I move on to checking my voicemail to see if any patients have called. Typically, the patient appointment is 10 to 15 minutes, and then I take everything off and they are on their way.
To be a successful radiation therapist at SkinCure, you need to be a patient-focused therapist. Your goal every day is to educate the patient fully. You also need to be a good communicator. You have multiple departments that you're communicating with.
The independence can be intimidating, but it's also nice because there's a lot of freedom. There's no on call, which is nice. So when you work for SkinCure, typically your hours are going to be the hours of the dermatology practice, which for most is Monday through Friday. Some offices are even closed on Fridays. You're off on holidays. I definitely feel like I'm part of the team there. The doctor and the staff and everybody has made me feel so welcome and makes me feel like I'm one of them, and they're very interested in SRT.
The SRT 100 Vision is a very user-friendly system that absolutely allows me to use my skills to treat the patient appropriately. Now we have a real-life image to show what's happening beneath the skin so that we can make changes appropriately to adapt to the needs of that specific cancer.
The technology is so amazing, and the patients love it. When I tell them about image-guided superficial radiation therapy, I say, you get to watch your lesion get smaller in real time.
I love seeing the relief on their face. You show them the ultrasound and you can just tell they just let out this breath of air that they didn't really even know that they were holding, like that it's gone and they don't have to worry about it anymore.
Honestly, you don't just empower the patient, you kind of empower yourself. Like, look at what I've done, look at what I could do. You know, look at who I just helped.
The reason SkinCure Oncology has such a special place in my heart is that being able to take care of patients who had skin cancer allowed me to still be able to do my job and help them defeat the beast in their home and have the rest of their life to live out and celebrate.